Hello all, I'm Saika Paurel. As per the requirement of the assignment 2, I along with other two group members, Umang Khatioda and Isuru, are going to present the topic of National Health Strategic Framework for Chronic Illness Management and National Health Priorities Areas. National Health Priorities area was developed in 1996 as a joint effort by the Commonwealth and all the state and territories government. It was formed in the response to the World Health Organization 2000 Global Health Strategy, and it aims to focus on illness that has a significant impact on Australia's health and have the potential for the prevention and the early intervention. There are 9 areas of the National Health Priorities area, and the 9 disease conditions are cardiovascular health, cancer, in injury prevention and control, mental health, diabetes mellitus, asthma, arthritis, musculoskeletal diseases, obesity, and dementia. Initially, there were 5 priority areas, but later, as the burden of diseases in the Australian community increased, the other 4 diseases were added to the list. Talking about the prevalence of the chronic diseases, according to the Department of the Health 2020, 1 in 2 Australians have at least one of the chronic illness. 3 in 5 aged over 65 years have more than one chronic illness, and the most frequent chronic disorder affecting Australians in 2017 to 2018, according to the Australian Bureau of Statistics 2018, are mental health, followed by the cardiovascular health, and all the statistics of the other chronic illnesses can be seen on the slide. Talking about the National Strategic Framework for the Chronic Illness Management, it was formed in 2017 by the Commonwealth Government, Department of Health, and State and Territories Government. Policymakers and the health care workers may use this framework to plan and execute the policies, activities, and services to help people with the chronic conditions. This framework also aims to help person with the chronic conditions and improve their health and the quality of life. The framework emphasizes the importance of the person-centered approach to ensure that all the people with the chronic illnesses enjoy happy life. Now I'm going to pass it to the studio for the next section. Thank you.
So as for the national health priority areas, I have selected diabetes mellitus, and more to be specific, I have chosen type 2 diabetes. So therefore, type 2 diabetes the most common in diabetes also in Australia and accounts for 85% of all diabetes. And type 2 diabetes is the beta cell dysfunction in the pancreas causing insulin resistance. And this results in failure of maintaining blood glucose level in the human body within the normal range. Moreover, higher number of fatty tissues can cause insulin resistance due to inflammatory mechanisms, thus increasing the blood glucose levels in the human body. And also, Aboriginal and Torres Strait Islander people are at a higher risk of type 2 diabetes, along with Asians, Middle Eastern, North African, and Southern European. And moving on to the next slide will be the impact of type 2 diabetes, and I'll be focusing on the physical impacts, which focus on the cardiovascular system, where it has a higher risk of stroke and hypertension, and moreover, diabetic retinopathy, which affects vision, and peripheral neuropathy, where nerve damage in peripheral areas may be even lead to amputation of lower limbs. Moving on to the mental impact of type 2 diabetes. Depression is one of the outstanding complications of diabetes, which can lead to alcohol abuse, affecting the diet, exercise, and losing the quality of life. And moreover, there are new findings that states that Alzheimer's disease also is another complication of type 2 diabetes due to the poor blood supply for the brain, that's shutting down of metabolic activities over there, which can impact on the memory of an individual. Moving on to the social and economical factors, financial issues, unemployment, Moving away from loud ones where an individual would isolate are some of the social and economical impacts of type 2 diabetes. Moving on to the statistics of type 2 diabetes on the next slide. You can see that in 2017 and 2018, 1 million people are diagnosed with type 2 diabetes in Australia, where the number has increased in 2020 to 2021, and it has come up to 1.3 million. And moreover, all the numbers are more favorable towards the males, where higher percentage is calculated over females. And moreover, there are 11% deaths in 2018 due to diabetes. The rest of the facts that have been uh, stated in here are related to diabetes, how they varies from the places people live, and which includes also the hospitalization. So I will hand over to Umang to continue the rest of the presentation.
So I'll be talking about nursing implication related to burden of disease. So the patient experience changes in physical needs, future plans, and there will be changes in their roles and responsibilities as well as they'll have different experience in adopting their uh, current health condition. Likewise, caring for a patient with chronic condition can be physically and mentally demanding. And for nurses, they will have increased workload, and it can be physically and mentally draining. And when there is lack of staff, which is currently a major issues in many hospitals and healthcare organization. Likewise, nurses can be emotionally affected, which can be due to their personal experience with caring someone with chronic illness of their family member or having to deal with the chronic illness. Sorry. Moving on to the next slide, I'll be talking about caring for someone with a complex condition in acute and in future. So according to AIHW, 51% of patients with one or more chronic illness were required to be hospitalized. Nurses and other health professionals play an important role in providing person-centered care, including different treatment options, reasonable and adequate education, which enables patient and their family member to make their own decision, referring to different health professions. Likewise, the National Strategic Framework for Chronic Condition provides an overview of success after reforming and implementing several activities that have already been planned. Future work for increasing the standard of care for chronic illness is said to be commenced in association with states and territories relevant experts. um, Likewise, if the frequency of chronic disease continues to rise, more hospital admission will occur, putting a strain on the staff to nurse ratio, and patient admission will increase if they do not receive appropriate treatment at appropriate time. So talking about roles and responsibilities of nurses and multidisciplinary team. So multidisciplinary team, one of the most crucial role of multidisciplinary team is to provide evidence-based education to patient and family. Team meeting with family members and patient is essential from the beginning of admission to the discharge and more than that. Proper and adequate education help them to understand their complex condition and adopt their condition along with the proper and appropriate use of medication and treatment plan. Likewise, the other role of multidisciplinary team is to provide adequate counseling related to financial support or emotional support to different social organization. Clinical nursing implication related to caring for someone with multimorbidities. Multimorbidities is the presence of more than one chronic illness in person that may be physical or mental. And nurses are expected to consider different aspects that includes patient health, patient family background, patient medical history, patient knowledge, and family knowledge. Likewise, communication is done within a group of people with a common goal, uh, which goal is to uh, which goal is the better patient health outcome. And this group of people includes a multidisciplinary team, their family members, and the patient themselves. Likewise, multimodalities can impact the judgment of nurses to prioritize emergency health attention, as patient with multimorbidities can have some might have few chronic illness and some might have more. So it might affect their judgment. To end the presentation, I have all the references we have used for the presentation. Thank you.